In this video, we are going to explain how test results are managed within the surgery. We know that when you have a blood test or other test taken at the surgery, you will be anxious to know the result as soon as possible. Unfortunately, it is not possible to contact every patient who is waiting for results. This video will explain the normal timescales you can expect for results, how the blood tests are checked and reviewed within the surgery, and how you can find out about your results. In general, most blood tests are available to the practice within 2 days of being taken. There are some exceptions to this, and you may be advised of this when your blood test is taken. Once a blood test result comes into the practice, the admin team will make sure that the test is sent to the clinician that ordered it. This may be a GP or in some cases a nurse practitioner. If the clinician that ordered your test is not available to review it within 2 working days, the result will be passed to another doctor to check on their behalf. Once the test has been reviewed by a clinician, they will mark this on the test result, along with any action or outcome of the test. There are a number of possible outcomes from here. The most common are: the test result is normal or satisfactory. In this case, the surgery would not contact you to inform you of the result. The response of satisfactory essentially means that the test is not completely normal, but that any abnormalities are minor or already known about and do not need further action. The test result is abnormal and requires further action. In these cases, the clinician will provide information to the admin staff about what they feel needs to be taken. This will either be urgent action or routine action. An example of urgent action would be to start an antibiotics for a urine infection, or to make an urgent review appointment because of a more serious abnormality in the blood test. Routine actions might include being asked to make a non-urgent review appointment for an abnormal result, which requires further discussion but not urgently. An example of this would be an elevated cholesterol, which is important but not something that requires urgent attention. For any urgent issues, the admin staff will try to contact you by telephone. If they are unable to contact you after several attempts, they will send a letter or a text message asking you to contact the surgery. For non-urgent results, the staff may contact you directly by text message, asking you to contact the surgery or perhaps collect a prescription. The admin staff attempt to contact patients with urgent actions as quickly as possible, and usually on the same day that the result has been checked by the clinician. If you do receive a text message from the surgery, it should clearly state that the matter is non-urgent. There is no need to be alarmed at receiving a message in this way. If you contact the surgery to ask for your test results, the admin staff will be able to assist you as best as possible. As the admin team have no clinical training, they are only able to relay information that the clinician has provided after reviewing the result. This might mean that they can tell you that the result is normal or satisfactory, but little else. Often the clinician will provide further information that the admin team can pass on to you. An example of this might be: blood test confirms low iron, prescription for iron tablets ready, and advise you to make a repeat blood test in 3 months' time. The admin team will be able to relay any message by the clinician, but they will not be able to expand on this. We aim to deal with test results as quickly as possible so that patients can get information and/or treatment again as quickly as possible and prevent any unnecessary anxiety. I hope this information has been valuable and welcome any feedback on the comments below or directly to the surgery. Thank you.